Can you imagine waking up every day not knowing who your family is? That's a reality for an estimated 35.6 million people worldwide diagnosed with dementia. I've taken a closer look and broke down what dementia is and how it can affect your life. Dementia isn't a specific disease, but rather an umbrella term. An article released by the Mayo Clinic defines dementia as describing a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily functioning. Dementia indicates problems with two brain functions, such as memory, judgment, language, and ability to perform daily activities. The Mayo Clinic looked at two different types of dementia, one being progressive, which means it's not reversible and it worsens over time. And some of these would be Alzheimer's, vascular dementia, Lewy body dementia, and frontotemporal dementia. All of these indicate problems with plaques and tangles in the brain, or protein clumps with reduced and blocked blood flow in vessels, or degeneration of nerve cells. Other dementia-like symptoms can be reversed through treatment by a doctor. These include symptoms stemming from infections and immune disorders, endocrine abnormalities, nutritional deficiencies, brain tumors, or reactions to medication. Signs and symptoms when it comes to dementia would be both cognitive and psychological. Cognitive examples would be memory loss, difficulty communicating, difficulty with coordination and motor functions, and disorientation, such as getting lost. Psychological changes would be personality changes, inability to reason, and agitation. An organization called Family Doctor states that you can't consider your problem serious until it's affecting your daily living. There's other disorders linked to dementia that either make you develop it later in life or just have shown signs through research, and that includes Huntington's, traumatic brain injury, and Parkinson's. And all of these include degeneration of nerves in the brain, uncoordinated movement, impaired speech or abnormal protein in the brain, putting you at risk for the development of dementia, according to the National Institute of Neurological Disorders and Stroke. Risk factors that play into dementia, some can be controlled and others can't. The ones you can control include heavy alcohol use, high cholesterol, diabetes, and smoking, and others you can't would be age, family history, and Down syndrome. The National Institute of Neurological Disorders shows different treatments on their website that people can look into, and that includes drugs or medication to treat progressive dementias. And something to pay attention to is realizing that it doesn't cure it, it just slows the progression and improves your symptoms. Early stage patients can benefit from task design to improve cognitive functioning, which I know from my jobs we used to play puzzles or just set up a regiment for my clients to just keep them on track. The Family Doctor Association listed a few non-drug approaches, which would be just modifying the environment, your responses to their behaviors, and different tasks throughout the day to reduce confusion. Another example that Mayo Clinic had was different aromatherapies and like puzzles and stuff that I mentioned before. Currently, there are no cures for the common dementia. A better understanding of the disease itself makes it possible for diagnosed patients and their families to meet the daily challenges they face. Continuing research will hopefully slow the progression or even cure and prevent the development of dementia.